Survey data has shown that more and more teenagers are using electronic cigarettes or vaping. So we're here today to talk about some of the dangers associated with vaping. I'm Dr. Julianne Schwerdtfager. I'm one of the pediatricians at Salina Pediatric Care.
Dr. Schwerdtfager, what is vaping?
So vaping is another word for using an electronic cigarette. So basically what this is an electronic cigarette is a device that you put liquid in and it turns it into an aerosol, and then you breathe that aerosol in.
What exactly is in the vape liquid?
Vaping liquid can contain a lot of different things. So a lot of vape liquid will contain nicotine, which of course is a big concern because this is an addictive substance, especially for children. Their brains are developing until they're 25, so we really don't want them to be exposed to addictive substances. But there's also a lot of other things in there, like ultrafine particles that people inhale. There are a lot of chemicals in there. Some of these we think in studies might cause cancer down the road, but there's still a lot to be determined with some of these chemicals.
I guess the question of the hour is it safer than smoking cigarettes?
That's probably not the way I would phrase the question. So the question shouldn't be, is it safer? The question should be, is it safe at all? And really, neither thing is. We obviously know that smoking cigarettes is not safe for anyone. So vaping, we're starting to see in studies, is also not safe. Especially in children, vaping, we know in teenagers will lead them to be more likely to use cigarettes later on in the next couple years. We've seen that very strongly in studies on kids who do vape. And we know that it is addictive because of that nicotine component. The other scary part about vaping is it's a pen that you can put anything into, which means that you could put any substance in there. That could include marijuana or illegal drugs as well, and that makes us all very concerned.
What can parents do to prevent their children from using these products or help them stop?
It's kind of hard to know if your kid's using e-cigarettes. Teenagers are a little more private, they have a little more free time, they hang out with their friends more, so you may not know if your teenager's vaping. And the hard part about this is vape pens don't look like cigarettes. They're not always obvious to identify. So sometimes they look like actual pens. Sometimes they look like flash drives for your computer or thumb drives. So another danger that we worry about a lot with vaping liquids when you're storing them at home is that kids can get into these and not know what they are. So if there is someone in the home that is vaping, we need to be very concerned about how that vaping liquid is stored. I think it is really important to discuss with your kids what vaping is, why it's dangerous, why we don't want you to do it, just like you would for any other substance. So as you would discuss alcohol or smoking cigarettes or doing other drugs. We obviously talk to kids about not doing any of these, so I would frame it just in that same sort of conversation with your children. Talk to your pediatrician. Pediatricians try to stay up to date on everything, so feel free to reach out to your pediatrician or one of us at Salina Pediatric Care. We're obviously happy to talk to you about this and give you more information and help you facilitate that discussion with your teenager.
Thank you so much for being on the show.